Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. R. Rajalakshmi. R. Rajalakshmi, she graduated, did post-graduation from Bangalore Medical College, and now she is a very popular practicing obstetrician and gynecologist in Udupi. And more than that, she has become the president of IMA in Udupi, and successfully she concluded that, and she continues to be a prolific writer. She is a columnist and she goes to many schools, colleges to bring awareness among the teenagers about the healthy habits. And recently she has come out with the Vatsalya Osuge. And this is a beautiful book in which, she starts right from the beginning, that is the from menarche to the menopause, all aspects of a womanhood and their problems and everything. She has given the solution to the common people how to not to worry and get treatment. So welcome, Dr. Rajalakshmi.
Thank you, ma'am. Thank you for that kind introduction. Thank you.
Women means anemia, anemia means women. So women in some time or the other in their lifetime, they would have become anemic because of some reason or the other. So first tell us, what is this anemia? Why it occurs?
Okay. Ma'am, we all know our blood has hemoglobin. And when we measure that hemoglobin, it should be between 12 to 14 for a lady and 14 to 16 for a male. So when the level of hemoglobin goes below 10 gram percent, we call it as anemia. When there is less blood in our body, that is the layman's term. So why does it happen? First is in ladies, as you already said, we have monthly cycles. The normal level of blood loss is 50 to 80 milliliter. If it goes above that, when we have irregular periods or heavy menstrual bleeding, so that is the main cause. Second is the nutritional deficiency. If there is no enough content of iron, folic acid, vitamin B12 and protein in our regular diet.
And especially younger generation is going for the junk food. And taking the junk food leads to anemia. They should remember, they'll put on weight, they'll be obese. To look at, they'll be plumpy, but they'll be very anemic. And this has to be stressed to the younger generation.
Yes. Because some of the contents of these fast food may hinder the absorption of iron in our food. Because we need to have vitamin C and all in good amount to have absorption of this food. That can cause. And rarely there are some disorders of the hemoglobin structure like sickle cell anemia, thalassemia. So that also can cause anemia. So these are many different varieties of anemia which we usually see in our practice.
Yeah, and in school going children, the worms, the round worms, hookworms, and all tapeworms, all of them, they can cause anemia. Yeah.
And even constipation and bleeding during defecation. Piles, what they usually say, that also can cause. And gastric bleeding, maybe due to gastritis or long-term taking that analgesic tablets, if they continue to take, there will be microbleeds, even that can cause anemia in some.
Yes. And that time the motion color will be dark colored. It will be black. And we call it as melena. And that also the way people should keep a watch on the color of the motion also. Now, how do you investigate and how do you find out the anemia is there?
Okay, because of their symptoms, when they feel breathless with the minimum activity, they have palpitations, the students can't concentrate, they get more sleep, and they have giddiness, they have sweating in their palms and hands. And if they are pregnant, they feel breathless, they get edema. All these things, we have to think that this might be anemia. So then we have to look for hemoglobin, and if they are anemic, we should go ahead finding out what is the cause of anemia and treat them accordingly.
Okay. Now, suppose the treatment has to be given. What sort of treatment do you give them?
Usually we ask them first is the nutritional supplements, though they have to eat more of leafy vegetables and this moringa, the drumstick, which is in craze now, that also increases. And they can have this fruits like apple, pomegranate, chiku. They can have sprouted grains and they should increase the consumption of vitamin C so that the iron they have taken gets absorbed. and
Yeah.
they have to restrict their caffeine and uh, coffee and tea, so that that doesn't hinder the absorption. And then
Yes.
when usually we give tablets, if it is severe we have injections to be given, and it is
Mhm.
very severe means we have to give them blood also. And there
Okay.
are some points which we tell them when we are giving iron tablets. One is, as you said that time, whenever we give some ferrous salts, the motion or the stool can get black colored.
Become
This is
dark.
the
Yes.
usual symptoms they come and tell us.
And they should
Second thing
become
is
afraid of it,
worried
because of the
about it. Yeah,
iron.
we should.
Yeah.
Yeah, we should tell them. And second is, whenever you take a iron tablet, it should be in
Mhm.
between the food, not immediately after the food or just before the food, because
Mhm.
it can increase the gastritis. And if it
Mhm.
is taken immediately after food, it may not be absorbed also. So in between food, we usually say 2 hours after food, and not to
Okay.
be taken with milk, because our common belief among our people is any tablet is heat. So make it cold, they take it with milk. So if you
No,
have
and
taken iron
another thing
tablet,
that they think, if they take on empty stomach, that they will have the burning and gastritis. And if they take with the milk, they think that they'll be safe.
yeah,
And yeah,
safe.
and that is a
Yes,
myth.
so
Yeah.
that will hinder, because calcium, and we usually tell pregnant ladies when we prescribe them iron and calcium tablets, not to take the both the tablets together, at least 3 hours
Together.
of gap between the two
Yeah.
tablets, so that whatever tablets we have given is taken up well. And take more of fiber, otherwise that will cause constipation, and which the general public says as heat. Doctor kotta matre heat agide, power agide. So we ask them, I usually tell them, see, this is a common side effect, constipation. So you have to increase your fiber content and drink lot of water, so that you digest it well and your
And
stools
the
are passed
fiber
out
content
easily.
is more with the vegetables and the millets. When they take
Yes.
millets, the fiber content will be more. And that too, if they take iron, I mean the jaggery
Yeah.
will have more iron. Whereas the sugar can cause the bone marrow depression, and then, again they'll
It'll
become
the
anemic.
production of red
Yeah,
blood cells only will come down.
will
Usually,
come
I tell
down.
them easiest way to take is chicky,
Yeah,
nelakadle and chicky,
yeah, bella,
jaggery.
yeah,
Yeah,
jaggery, excellent.
jaggery. They
Yes.
are both good source, protein as well as the iron source, so that
Iron,
will
both
cure.
are there. Yeah.
Yeah, or
And
usually they take
yeah,
beetroot. Beetroot is
correct.
also good. Beetroot will give them good amount.
Okay.
Even dates,
Mhm,
karjura. Karjura
mhm.
also they can have. But once we get out these names, the first thing they say, doctor, idu heat agtade. So we should tell
Yeah.
them that you have to be taken with the fiber and good amount of water, then it will be fine. If it is due
And
to some other causes,
yeah. And one more
yeah,
thing, the symptoms of anemia are exactly like the heart patients. So many a times,
yes,
because they have the palpitation and the breathlessness and the easy fatigability, they have become tired, and then the chest pain also can come. And, even some doctors can mistake. So, like olden days, like how we were taught, first examine the conjunctiva
yes,
and then ask them to show the tongue, and then you'll
tongue,
never miss anemia. You'll never miss anemia. And one of our
yes.
PG had posted a patient for angiogram, and when I saw on the table, on the spot, I said, oh my god, this is anemia. Why are you doing angiogram? And then, hemoglobin was 2 grams, and this is the severe anemia. So one has to keep a watch and not just listen to the symptoms, examine the patient properly,
Examine them
because
and then
what is causing the anemia has to be, the root cause has to be found
root
out.
cause to be
And
seen.
you
Yeah.
said about the injectable iron, and they are not free of any side effects. One of our own senior doctor, a senior, she died because of the reaction to the iron injection during her pregnancy. So these are very out of the thing, like once in a
Yeah,
way,
this may be
but very,
rare
very
incidents,
fearing.
ma'am.
Yeah. So
Rare
never,
incidents, because
never, yes,
we
yes.
were not
And
giving IV injection in the beginning. Now, but
yeah,
since for 5 or 6 years, we are giving those iron sucrose we were giving. Now we are giving iron FCM injections also in pregnancy. They are safe. But
yeah.
every drug has mild side effects. So we can't say who will
And
have a side
the
effect.
best thing is to not to go to the stage where you have to get the
Yeah,
injections.
where you need all them.
That
That's
is,
what. Try to
prevention is better than cure. Yes.
better than always cure. So
Yeah.
if it's a mild anemia, better to do a dietary modifications, and then take with the tablets, syrups, and if it is very severe only, we go for the injections.
Injection. And if
Otherwise, if
it
it is
is
too
an
severe,
emergency, then we give
then
the
blood transfusion.
pack cell blood
Packed cell.
transfusion.
Yes.
Yeah.
Because
Because the
the
whole
volume will
blood
be
can cause
more
the heart failure. Yes.
heart failure. So we can't give the whole blood. We give a packed cells to them. That's
Yeah,
why.
yeah. That
Yes,
is
ma'am.
really nice. So in fact, every woman, by looking at her face only, she's not fair. They shouldn't think that they are fair. It is the
Yes, that should
anemia.
be told to
Anemia.
them.
Yeah,
Yeah.
yeah.
Anemia. Their
Yeah,
hands
yeah,
and their nails and their eyes, they should always check.
yeah.
Even
Check.
sometimes they might get pedal edema. They think that they have put on weight. It is not due to
Yeah.
putting on weight. It is
Wait.
because there is a fluid collection due to anemia. They are they have gained weight. That should
Yes,
be told
yes.
to them.
Yeah,
Yes.
yeah, yeah.
And
So,
especially
yeah.
ladies, no, in the
Hmm.
adolescents and in the perimenopausal age, they think bleeding more is common. It
Yes.
is a known
No,
fact.
no.
So they neglect it. They don't take help. They don't come to us. So because of the excess bleeding, they can go for anemia. In such cases, they have to go and take a medical advice.
And
Yes.
another mistake, what happens is, because they put nail polish, they can't make out the
Ah,
pallor in the nails.
color
And
in
then
it.
because
Yeah.
they put lipstick, the pallor cannot be made out. So one has to look into the conjunctiva and also
Conjunct-
the tongue.
Tongue
Immediately
and
you can
even
make
the
out, and the palm.
palms. Palms can
Yeah,
be made out.
palm.
It
Yeah,
can be made
yeah.
out. That is
It's
the
really,
easiest way to make out whether lady is having anyone is having
yeah.
anemia. Yes,
And
ma'am. Yeah.
Rajalakshmi, we were so experts clinically. By looking at the conjunctiva, we would tell how much is the hemoglobin. And when we used to do it, I mean, those days we ourselves used to do the hemoglobin, and it used to be
Yeah.
exactly like that. So the clinical acumen is very important, and
Very.
we
Yeah.
have to tell the ladies that health, her ability to work depends on the hemoglobin. And if the
Yes.
hemoglobin comes down, she cannot perform her work,
Cannot
daily
work.
routine.
Yes, yes,
Yeah,
that has to
and
be
they
told.
get tired,
And
so they have
one
to,
more
yeah.
thing to keep in mind is deworming. The
Yes.
students are now every time, every 6 months. The school begins in the June month only. They are given deworming tablets. They are repeated
Hmm.
after 6 months, and it
Hmm.
has to be taken.
Hmm.
Even government has made it compulsory for pregnant ladies also to take deworming tablets, so there is no anemia in them.
Yeah.
And it has such nice schemes that it provides 180 tablets of iron and folic acids to be given to any girl who has anemia. So
Okay.
it is not
Okay.
that it is a ferrous sulfate salt, so sometimes they can have a constipation, but still it has good results. So there
Yeah.
are so many programs which to help them. People should be made aware that they have such programs. They can make use of it.
Yeah.
That is
So
also one of the
government is
important things.
making all effort to see that our children and women are healthy. But then they
Yes,
must realize that they have to make an effort to take those
yes,
tablets and things.
yes, yes.
So
That's what.
ultimately, what is the key things that you would like to tell for the women to prevent anemia?
One is the awareness, what happens in anemia, what is anemia, and how much should be their hemoglobin. Now everyone knows. And
Hmm.
second, take care of their nutrition, include proteins, include iron content, include vegetables, raw fresh vegetables, which you
And
give the folic acid.
include jaggery and not the
Yeah,
sugar. That is
sugar,
also
include that.
important. Yes.
Okay. And deworming. And when you have excess bleeding for more days or heavy in amount, please consult, go to a doctor. It might be to some other cause which is leading to anemia. People
Hmm.
think that anemia andre rakta irudilla, rakta will be less. So we won't bleed, but it is a vicious cycle. If you have anemia, you will bleed more and again that will cause anemia. So they have
I
to
know.
be careful about it.
Yes,
That is
yes.
what I would like to tell them.
Yeah. Thank you so
Yes.
much, Dr. Raj Lakshmi. In fact, whatever you have told is an eye opener, and every woman should listen to you and protect her health and then be healthy, wealthy, and very strong.
Yes.
And thank you very much, Raj
Sure, ma'am.
Lakshmi, for your very
Thank you, ma'am. Thank
beautiful
you so
and
much for the
nice
opportunity.
advice. Thank you.